Brazilian butt lifts.
Of course.
And just, you just say that and it conjures up all kinds of images. Beyonce, Jennifer Lopez, that is the ideal of female beauty, to have a well-shaped derriere?
Certainly. I mean, it's when you think of a beautiful woman and a nice shape, you really think of that Marilyn Monroe 36, 24, 36. Or nowadays with J-Lo or Beyonce, the really nice behind or buttock area, nice firm, has a nice shape to it, and really balances with the waist. And going back in history, they've talked about the shape that's most attractive to the opposite sex, or just a feminine shape. There's a ratio between the waist and the hip. So having a fuller hip and a very small waist is very feminine and attractive.
Okay, now besides going to the gym and working on those glutes nonstop, what alternatives do people have?
So that's, I would say, primarily you want to try to work out and try to see if you can get your glutes, like you said, firm, then toned. But sometimes, occasionally, we're not born with that nice behind, and you need a little bit of help. A very popular and natural way of taking care of it is actually transferring fat from another part of your body there where you may have excess, for example, your waist or abdominal area, and actually transferring into your buttock. So it's like a win-win situation. You get a nice waist and you get a nice booty.
Okay, so is that relatively new? Were they at one point doing contouring of another sort?
Yeah, the other big way of doing it, and sometimes it works in some women, is actually having an implant in. It's generally more for women who have no body fat, who are extremely skinny, and there's no way of getting any fat to the behind. And so you would put an implant in, but some of the side effects of implants are that they're solid materials. They have a slightly higher chance of complications such as infections.
We actually have some pictures we can be showing people too, so let's go ahead and roll those as you're talking about this.
So this is a woman who we actually did the Brazilian butt lift, or transferring of fat to the buttock area. So for her, we actually removed fat with a very gentle liposuction to her abdominal waist area and transferring it to her behind.
Okay,
so you can see the nice improvement.
So it actually is a double whammy, I guess is what you're saying. You're taking from the tummy area and then transferring that. And that isn't something the body can naturally do, or is it after you've tried everything that...
Exactly, because I mean, if you're not born, and same thing, there's another patient with a similar surgery. If you've tried everything and you really can't enhance your behind other than work out, then you really have to transfer fat. And so the best area to do that is try to find areas of excess fat. The liposuction is done very differently than traditional liposuction for that. Generally, when you do liposuction, you're really trying to harvest as much fat as possible. You're doing it under higher suction, things like that. Whereas when you're trying to transfer harvest fat from a certain area, you have to do it under either handheld suction or low suction, and when you get the fat, it has to be processed, so you remove the blood cells, you remove the triglycerides and liquid, and then transfer that gently into the buttock area.
I'd be curious, is this relatively new, this procedure? Have there been technological advances that have allowed you to do this, whereas previously you couldn't? Yes,
I think it's getting more and more popular. The actual concept of fat transfer isn't that new, but in high volume it's more new. So this is a high volume transfer. It's what we've noticed is that you really need to know how to harvest the fat and clean the fat before you inject it in.
And how safe is this?
It's actually very safe because you're using your own body's tissue and transferring it over. So you can't get any rejection from that, things like that.
Okay, and just curious, I mean, is it the same fat that's in the stomach that would end up in the derriere area? I mean, does it stay there? Does it get absorbed into the system? Is it transfer?
Yeah, so it's very true. So it is the fat that was genetically in your abdomen that's now in the behind area. So it has memory of what it did earlier, so from its source. So if you were to lose a large amount of weight, you'd notice that after fat transfer, your bottom may decrease a bit, just like your tummy did. Or if generally your abdominal area is a resistant area to fat loss, you wouldn't lose that.
All right, this is all fascinating. We've got to take a really quick break, and I know you have a couple of other